Hey everyone, welcome to the Doc Wishloff podcast. On today's show, we are going to be talking about how you approach a diagnosis. In the classic medical, physiotherapy, chiropractic, classic systems, you start from a place of discovering a medical diagnosis. Now, a medical diagnosis is generally an indication of damage. What is the structure that is damaged? Now, this approach is really effective for acute injuries. Now, when I say acute, I generally mean traumatic. So that type of injury means something external to you has created the damage. So you got hit by a bat, you fell down the stairs. Those types of injuries, diagnosis is really helpful because we know what the mechanism is. It was outside of your body. A diagnosis in that regard is less productive for the type of injury that occurs because of how you are moving. Now, that is the world that I live in. That is what the posture revival and my programs go through, are injuries that are the result of how your body is coordinating and organizing movement. In these scenarios, it is not as valuable to start from the place of what specifically is your diagnosis because the diagnosis is the result of how movement is being distributed in your body. So more importantly, we want to come at these types of injuries from a biomechanical or biochemical perspective. What are the conditions in your body that are leading to that area being overloaded? Because we're not going to solve the damage if we are just focusing on the place where the damage is when it comes to atraumatic chronic injuries, meaning there's not an external force causing it. It is your movement that is causing the overload point. And I'm super passionate about these types of injuries because this was my story as an athlete. And it's kind of my story as I work through postpartum and motherhood, right? There's not a resolution to the types of problems that have existed in my body historically. And so the approaches that people were taking with me were, well, if we just stabilize, right? If you hurt your back, we just stabilize it, it should go away on its own. If it's acute, it will. But if it's caused by the way your body is generating movement, it's not going to change until you change how you generate movement, which means you can't focus your energy and your treatments on the site of damage. Because oftentimes in these types of injuries, the site of damage is where the most movement is actually happening. The areas you're not feeling and not moving are where we need to input movement, is where we need to input treatment so that there is a new force distribution system being introduced to your body. And it is really hard to find practitioners that do this effectively because it is not taught in formal schooling. Now, this, again, is something I'm so passionate about because these were always the types of injuries I had. It was never something that was like surgical. It was never something that had a roadmap that was super clear. It kind of hurts when I do this, but then it's okay for a while, but it never really feels 100%. So if that sounds like your type of injury and you are still identifying the problem as the diagnosis, I want to encourage you to take a step back and start to understand why, and start to look not just at the site of pain, but look at that system as a full body unit. The easiest way to sort out this type of question is to start to look at your body in parts and pieces. So looking at how your foot pressure is being distributed, how your pelvis is balanced and your hips move with your pelvis, looking at your rib cage and your breathing mechanics, looking at the movement of your shoulder blades, looking at the movement and position of your head, your eyes, your jaw. I'm going to drop a free resource down in the comment section here. It's going to be my free posture self-assessment guide. So what I want you to do is, if you're dealing with a chronic injury, I want you to start to get used to looking at your body as a system. Now, this free resource I'm going to give you in this podcast note is going to help you piece off your body in sections and start to address imbalances and start to understand what is moving differently on one side versus the other. When we can start to catalog the differences in the movement and stability of your body and the way that it's kind of generating and producing movement, we can start to make a plan. And that plan can't be just try to make this spot hurt less. It has to be changing how force travels through your body. That is the only way you can solve an atraumatic chronic injury. So I'm going to explain through this process in hopefully a context that gives you some perspective. And the injury that I'm going to talk about is plantar fasciitis. Now, I see many people with plantar fasciitis in my clinic, and what I'm here to tell you is that everyone's approach to how you resolve and look at plantar fasciitis is different. And there's a number of reasons why this is the case, but I want to talk about a sampling of 3 different people that came into my clinic the other week with plantar fasciitis. The first was a rugby player and firefighter who had right foot plantar fasciitis. The next was a 70-year-old golfer who had pre-diabetes and was on some medication for some metabolic issues. The last was a client who had bilateral plantar fasciitis, meaning 2 feet plantar fasciitis. She also has endometriosis and PCOS. So each of these people have plantar fasciitis. So if you were to Google or look it up on Instagram, you'd see like strengthen your toes and scrape your feet and ice them, and maybe you have heel spurs or whatever the case is. You would see the diagnosis and the little roadmap that people show you how to stabilize and strengthen that isolated piece. Now, the problem with this and all things that you can Google is it does not come in the context of what's happening in the rest of your body. It does not come in the context of what's happening hormonally or metabolically. And all of these things are going to play a role in how your body recovers from plantar fascia irritation. So when we think about the firefighter, what we unwrapped was there's a workplace issue, right? She's in steel-toe boots. So there's a restriction that comes within that. But it still doesn't explain why it's one foot versus the other. Slowly, as we peeled down her movement and we went through that postural assessment where we go piece by piece by piece, we started to understand that an old shoulder injury where she had separated her shoulder on the opposing side was disrupting the rotational control from side to side in her body and leading to an excessive amount of rotation pouring into her right foot. So it wasn't a matter of training volume. It wasn't a matter of strengthening her feet. It was a matter of balancing the rotation at her torso and shoulders. So she had done months of toe strength, months of foot stretching, got orthotics, did the whole thing, the shockwave, the everything. None of that was ever going to solve her plantar fascia problem because the reason for the plantar fascia overload was her shoulder and ribcage movement. Place that aside, let's move on to the next case where we're talking about a golfer in his 70s with metabolic issues. If you have someone in your clinic or if you listening to this podcast have anything going on with your thyroid, with your pancreas, with the way that your body is managing blood sugar or shifts in your hormones, this is going to change how your connective tissue rebuilds. And so what occurs within this, especially when we're talking about something like diabetes, when the vasculature is actually changed, you are going to change the quality of the tissue in that area. So in the case of this golfer, same idea, had gone through the Google lists and the toe scrunches and all of that jazz, but he hadn't addressed his nutritional state and his medication status. We need to change how his body is creating connective tissue before we start to put in anything that's going to create more damage. So this would be a really great example of shockwave would be a really bad idea with this client because the fabric that is creating the tissue is building up in a abnormal way because of some different disease processes happening in his body. And I take a pause to address this kind of more specifically because I think a lot of the time people go into treatment, and practitioners, especially if you're listening to this, you go at it and you're like, this hurts. I'm just going to beat it up, right? I'm going to scrape it. I'm going to stab it. We're going to shockwave it. And we're just going to beat the ever living out of that tissue. Now, if you have a plan that includes nutritional, updates and making sure that that tissue is healing normally, dosing in some damage can be productive. But if that person's healing process is dysregulated, you are doing them a disservice by treating a tissue super aggressively, because you need to first create an environment where that tissue can heal in a more productive manner. Because the more damage you put in and the more abnormal healing you get, the more susceptible that tissue is to being damaged. And so with that client, really what we want to be observing is his nutritional status. Yes, he had some irritation on one side more than the other because golf was involved in the picture. So from a movement perspective, which is my jam, we're talking about foot rotation, control of the arch, foot rotation connecting into the hips, torso rotation, and then we're talking sequence. How are you sequencing this? Are you initiating your golf swing out of the ground, or are you jamming it out of your arms and then your feet are trying to catch up afterwards? So we ended up shifting our energy into sequencing his golf swing and working with his coach so that we made sure that the mobility and strength paired up with the work he was doing in his golf swing. But ultimately, I'm not going to be applying an aggressive form of treatment to this client until we feel like his hormonal state, blood flow, and his capacity to heal has been normalized. The last client case was a client who had PCOS, endometriosis, and had a bout of bilateral plantar fascia pain. Her pain came within the first month or so of getting surgery to remove endometriosis lesions from her abdomen. Now, as we think through this case, there's a few things that come to my mind, and one would be the hormonal state. So, levels of estrogen are going to start to shift and change the flexibility of your connective tissue. So if we are missing estrogen, we're thinking of, she was going through treatments for Lupron. So, drastically dropping and changing her estrogen levels. Menopause is the exact same thing. If we have a decrease in the level of estrogen, we have a stiffening of the connective tissue. So this kind of surgical incision and then the hormone therapy, there's an environment where there's a change to the quality of the connective tissue. So that's kind of the first thing that we want to be, again, just addressing it at the forefront, because that's going to change how I treat that tissue and how much stress I put through that tissue. We cannot get super aggressive again on something that is not healing normally, because you're going to, no pun intended, shoot yourself in the foot. You're going to explode your plantar fascia. So really what we want to be addressing with her is support. So this is a scenario where I'm saying, let's get orthotics, let's change your foot, your shoes, your etc., until these hormone levels can be normalized, because there was a purpose to this big shift in hormones for her. What we're not going to do at this time is do a ton of scrunchies and tippy toe curls, because it's already gripping and panicking because the connective tissue isn't working effectively. So what we're actually working on with her is retraining arch movement and tibial rotation. So the rotation through her knee, through her shin, through her hip, because the cleaner you can get with that motion of rotation, the less stress that's actually going to have to ride in that plantar fascia. So we're using external supports and we're using alternative strategies in her body so that we can offload that plantar fascia structure. I hope this gives you a little bit of food for thought. There's one more case scenario and I want to bring this up just so that it kind of touches base. If you're someone listening to this podcast and you're listening because you have plantar fasciitis, or you're working with a client and you're kind of stuck, we always want to make sure that we are checking the movement of the big toe, and specifically the extension of the big toe. So extension of the big toe happens when you are pushing off. So when you walk, your big toe needs to extend to effectively push off the ground. If the movement of the big toe is compromised, you are going to change how tension is wound up into the plantar fascia. Often you'll see the problem isn't that the plantar fascia is tight. The reason the plantar fascia gets tight on people is because of a principle that we discuss in the posture revival programs, but slack. So how quickly and efficiently can you pull tension into your plantar fascia and push off? If your big toe extension is compromised and there is a moment before you have full tension in your plantar fascia, that's actually when you're going to have problems, especially those problems on the inner edge of the heel, like that inside edge of the plantar fascia. That to me reads as an issue in how your plantar fascia is snapping into tension and how your big toe is facilitating what's called the windlass effect. This is a biomechanical phenomenon where the actual plantar fascia pulls tension because of extension at the big toe. So I'm a little concerned about the tightness of the plantar fascia when someone comes in to see me with an issue of the big toe, but my bigger concern is how you are snapping tension into the plantar fascia, because oftentimes what happens is there's a small delay because of the way the big toe extends that creates, if you think of a rope, if we pull and we have tension on it, we kind of push more tension and less, it's fine. But if we go completely slack on the rope and then slam it into full tension, that is a lot more force for those fibers to be dealing with. So we actually want to make sure that we have really good solid tension within the plantar fascia. That's actually what's going to stop your plantar fascia from hurting. So sometimes you're doing more harm than good when you're trying to roll it out all the time because you're not effectively winding up tension into it. So your body automatically stiffens up your plantar fascia in response to that slack that's always in the system. So improving how much big toe extension you have and how effectively you can control that toe off position is really important as well when it comes to plantar fascia pain. Now, we are coming to the end, my friends, but I bring up all these examples to say that the diagnosis is not the treatment plan. And this is especially the case for the types of injuries that I deal with in my clinic, which are atraumatic. There's not a crazy external force that hits you, and they're chronic. They're happening all the time, and they're because of the way your body is moving. So if you are the type of person, if you're a client and you're listening to this and you have plantar fasciitis and you're like, oh man, I've been doing the rolling and the toe curlies and the towel stuff, and I was thinking about dropping some bucks on Shockwave, I would strongly suggest you start with my posture assessment guide within the program notes. Again, just see where movement is being distributed in your body. Figure it out. Figure out the big pieces and start to make adjustments to those as a starting point. Because if you have not been getting resolution from the work that you do, from the top search of Google types of exercises, it's probably because that's not where the solution is actually going to lie. The other thing I take away from this for you guys listening is your metabolic health, your hormonal health is not separate from the health of your connective tissue. And so if you are listening to this and you're pregnant or you're menopausal or you're diabetic or you have thyroid issues, if there's something happening within the way that your body is processing energy and creating tissue and creating hormones, that shows up as alterations within the fabric of your connective tissue as well. So those are not two separate things, and we want to make sure that we're identifying the onset of these pain points if they are corresponding with anything happening in the rest of the systems of your body. That is a wrap for today. I hope you guys learned a little bit about plantar fascia and learned that a diagnosis is not a treatment plan. It ain't the treatment plan. It is identifying the structure that is hurt. It is not giving you the answer as to why it is hurt. So dig a little bit deeper. Make sure you're downloading that free resource that I have in the show notes, and I will check in with you guys next time. Once again.